You're listening to the RC Executive Lounge podcast, the show where healthcare revenue leaders share real-world strategies, hard-earned lessons, and bold ideas shaping the future of revenue cycle.
Hi, everyone. Welcome to the very first episode of Season 2 of the RC Executive Lounge podcast series. I'm your host, Praveen, and I'm really glad you're all here for our Season 2 premiere. My heartfelt thanks to all of our audience for your amazing support for Season 1 that we are continuing with Season 2 of this podcast series. I'm extremely excited today to welcome a guest whose experience spans frontline patient access, consulting, and system-wide revenue cycle leadership in a major academic health system. Our guest is Blake Evans, who serves as the System Vice President of Revenue Cycle at Rush University System for Health in Chicago, a multi-hospital academic health system with more than $3 billion in annual operating revenue. In his current role, Blake is responsible for the performance and transformation of the end-to-end revenue cycle, bringing together patient access, mid-cycle operations, and back-end functions under a unified strategy. He draws on more than 15 years of revenue cycle leadership experience, including roles as Director of Patient Access at St. Vincent's, Senior Manager in Healthcare Performance at Crowe-Harvard, and Associate Vice President of Patient Access at Rush before stepping into his current system-wide position. Blake's path into this work is rooted in hands-on frontline experience. He started his career in patient registration and access in a community hospital setting, then moved into consulting and performance improvement, where he led large teams, implemented platforms such as Epic and Meditech, redesigned front-end revenue cycle processes, and helped organizations reverse financial declines through technology and process redesign. That combination of operational depth and strategic perspective continues to shape how he approaches his role today. What I find particularly compelling is Blake's leadership philosophy. In his first 90 days as System Vice President, he met with more than 70 leaders and stakeholders across Rush to listen first, understand the landscape, and co-create a shared vision for the future of revenue cycle, one centered on digital transformation, process optimization, and a much, much better patient financial experience. He has spoken about the importance of team alignment, transparent communication, and having the courage to make decisions with the best information you have at the moment, even when the path isn't perfectly clear. We will talk today about his journey from frontline registration to system leadership, how he's thinking about automation and a more touchless revenue cycle, the role of front-end access and patient experience in financial performance, and most importantly, the leadership lessons he has learned along the way. Now, let's welcome Blake Evans. Blake, welcome to the lounge.
Being so very happy to be here with you.
Fantastic, Jake. Fantastic, Blake. Let's dive in. RCM teams historically have been known to have so much pressures, not ordinary type of pressures, because RCM environments are known for limited resources, significantly limited resources, but a lot more work than a normal team can handle, right? So thinking about all these and the fact that payer delays, staffing gaps, everything is putting pressure on your environment, how do you typically go about thinking about your strategic priorities when you look at the next 12 months, the next 3 years, and on and on?
Yeah, that's a great question, Praveen, and I can attest to there is no shortage of pressure in the revenue cycle. And I think this is very common, really, of every organization, healthcare organization. There's a tremendous amount of pressure being put on margin, less and less payment sometimes from our insurance companies, more pressure on patient liability. And so, it is that pressure that's there. And I think sometimes our priorities, they really can change not only on a daily basis, but sometimes even hourly, right? How do you focus your time? How do you focus your energy? What can you impact today versus tomorrow? And I think one thing that's been very good for us is that at the onset of me stepping into this new role as the System Vice President of Rev Cycle, not only did I sit down and talk to leaders to try to understand what was most important, but with our leadership team, we actually sat down and defined what do we want to try to tackle? And that became our quote unquote strategic priorities for this year. And so we have four. One is to become one rush revenue cycle. So bringing all of our team under one team, one structure, same processes. So that's our primary focus. But we also want to optimize revenue, right? So we need to ensure that our normal blocking and tackling of revenue cycle, that we're doing that to the best extent that we can, collecting every dollar from our insurance patients, help provide patients with options to pay their bills up front. The third thing that we're looking at is how do we even enhance that patient financial experience, right? You can receive great care in a hospital setting, but if you have a bad financial experience, that can really impact the patient's perception of their care. So that's at the forefront of our strategy. And then lastly, we want to continue to scale via automation. You kind of mentioned not only is that pressure there, but you can't throw an endless amount of bodies at the pressure, right? And so we've tried to think through how do you continue to scale the great work that we're doing, but do that through the lens of automation.
Fantastic. And you talked a lot about patient financial experience and automation. And every time we go to events like MGMA, HFMA, and all, every major RCM event and panel for that matter, there are a few topics that come out repeatedly. One is like denial prevention, second is patient financing, third is financial assistance. Now, these topics, how do these fit into your strategic roadmap when you think about it for the next 1 year versus the next 3 years?
Yeah, it's a great question. I think, if you go back to those four pillars that I just mentioned, one of those pillars were optimizing revenue, right? And so the way you do that is to, one, ensure that you get bills and claims out the door on a timely basis. So we do a lot of that work, but really it's a lot of our battle with denials management. And so throughout this last year, we have stood up a really robust denials management program where we have cross-team collaborations. Our clinical teams are part of our denials management group, our revenue cycle teams are there. And so I think what we have been able to do is really put our energy in a united front and not, attacking one department to another, because that can sometimes happen. Like, oh, it's your fault this happened. But we really focused it more on how do we work together to identify trends and how do we work together to fix those. So that has really proven to be successful for us this year, where we've actually seen some decreases in initial denials where we were seeing some spikes. I think the other thing that adds that pressure is that anywhere you read right now, especially with the new budget bill, there is a lot of projected impact to patient liability. Patients may be losing coverage, more responsibility. And so you have to think through how do you help your patient population through that. And so as we are trying to adjust kind of what we're seeing as kind of the tea leaves are coming, right? We're thinking through how do we continue to reinforce options to our patients? How do we inform them as soon as possible of what their liability is going to be? How do we give them the greatest amount of payment plans and extend those payment plans? How do we communicate over and over again? And really, how do we act as an advocate to the patients to help guide them through that process, not only at the time of scheduling, but all the way through registration, to the point of getting your first bill, to the point of, getting your second and third and fourth statement, and really trying to be very intentional about how we communicate with our patient population.
Fantastic. And how do you look at it in terms of like financial assistance and patient financing? Because when we look at the problem, everything starts with claims, but then quickly travels downstream into patient financing and financial assistance. Uh, can you talk to me a little bit about how you holistically look at this problem?
Bucket it this way, but I'll categorize it this way. Is that in any healthcare organization, you're going to have patients who come through your organization who, one, are just totally uninsured. So they have no insurance at all. And so your goal as an organization is to really try to help do one of two things. One, determine if the patient has the means to pay, and we just need to work out a payment plan structure for them. Or if they really don't have the means to pay, are there programs that are available to that patient to help them get some type of care payment? So, and that could be, screening patients, see if they qualify for Medicaid, and we do a lot of that. That could be, we work with a patient financing company that will help do a 0% kind of loan to the patient, and we help them through that and kind of work through payment plans. So we do that as well. But we also have financial assistance, right? And I think, most organizations will have different guidelines around their financial assistance. I would say we're pretty generous in the Chicago market in terms of how we are helping our patients with financial assistance. But with that help, you have to ensure that the patients that are most at need and most critical kind of receive that financial assistance, and it doesn't become a coverage type that a patient will receive ongoing treatment. So we try to be very mindful of how we allocate those dollars to our patients, how we serve the patients most in need. And then how do we also navigate the patients to maybe a FQHC partner where they can receive care in those settings as well, because they do great work there too. So it's really one, really flipping the mindset of it's not just about payments, right? It's really about how do you help advocate for that patient, and that advocacy would be what's going to be the best financial option for that patient, whether that be charity care, whether that be Medicaid, whether that be navigating them to FQHC partner or community partner.
Yeah, ultimately, what we are hearing is patients' asses go through a lot during difficult times, and making the experience as seamless as possible is very important for them. Seems to be the principle.
Absolutely.
Fantastic. Now, senior leaders in your position, you all feel this pressure of having to say no to even some really good initiatives because you're going to have a team who comes up with amazing initiatives. There will be a list of 20, 50, 100, whatever be the number. You can probably pick a handful of them in a given year, given the resource constraints. So, how do you determine how to say no? And probably, can you give me an example of when you had to say no to a really good initiative sometime in the last 1 to 2 years?
Yeah, so I think about my kind of foundational days in leadership, and we at that time, the organization I work with, we engaged with it used to be called the Studer Group, right? And the Studer Group had this way of one, you will have a lot of times that your frontline teams will come to you and bring you ideas, right? And so they had a document that you would kind of yellow. It was called a stoplight report. It's called red, yellow, green, and so what it does for you though is to really help assess things very quickly. So if it's something that you ingest, it's an opportunity, and it says, "Hey, this is not the right time. It's not the right alignment with what we're strategically working at." We put that in red, like, "Hey, we're not going to do it, and here's why." So we just communicate that. There's another light, yellow that says, "Okay, this is a good idea, but we can't do it right now, but here's when we can do it." And so we try to think about it, Praveen, not so much as saying no all the time, but really yeah, this actually is a viable solution, but we can't ingest it right now. So when can we, and when can we put it on our roadmap? Versus green is, hey, everything, the stars have aligned. This aligns with our priorities. This aligns with what we need. And that's really how we have ingested a lot of opportunities over the last several months. It's just try to really understand what is it that we know we need today, and are there solutions that align with that versus, hey, we could really use this, but, we got to get this in first, and then we put that in yellow versus things that we readily look at and say, hey, this is not the right fit for what we're doing.
Makes sense. The framework sounds very exciting. Blake, thank you so much. With that, let's take a short break. When we come back, we are going to listen to Blake talk about a very specific initiative that his organization led and the impact of the initiative. Please stay tuned.
This episode is brought to you by rchq.com. That's ARCEEHQ.com, the agentic AI platform helping healthcare providers improve financial performance by simplifying patient financing and financial assistance. From faster approvals to fewer write-offs, RCHQ makes it easier for patients to pay and for providers to get paid. Learn more at rchq.com.
Great. Let's jump right in. Blake, one of the things that our audience always like to hear about is an end-to-end initiative that your organization led. What challenges were you solving for? Can you talk about what was a challenge for this specific initiative, and how did you go about thinking about what could be a good solution for this initiative?
Yeah, so this is it's one of those things where really the stars have aligned in my favor. So when I stepped into the role, one of the major initiatives that we had as an organization is how do we continue to unify our revenue cycle. So historically, we have three hospitals under the Rush System for Health umbrella, and two of the hospitals were under one revenue cycle team, and then we had another hospital that was under a different revenue cycle team. And so one of my goals is to really bring all of that under one unified leadership structure. Now, in addition to that, we are going through a lot of systemization changes throughout Rush. And one of those changes is that we had several different environments in Epic. So we had three different service areas in Epic. And so over the last year, we have gone through what's called service area consolidation. And that actually went live over the past weekend, just this past weekend. So we are actively involved in service area consolidation. And when you
Congratulations,
think
by the
about
way.
that, thank you. Thank you. That was a huge feat. But it's particularly important to me in my role because in that process, we had to really look through every single revenue cycle process. We had to talk about it, talk about how does this align to Epic's foundation? How does this align to best practice? How, what are the better results that we're seeing across revenue cycle and help make a decision? And that was really something that helped to bring our team together and again, kind of focused on what's going to be the best outcome for our teams, what's going to be the best outcome for our patients. And there was some hesitancy, as you can imagine, as you're kind of trying to bring groups together. People like, hey, don't steal my cheese, or this is my area. But we have really been able to come together through this project because we've had to do the work. We've had to kind of sit down and make some really tough calls and decisions. And all signs, even though we're just in the first few days of it, things have gone better than what we expected. I think with any type of big change like this, there are going to be issues, and I think that's one of the things that we communicated not only to our frontline team but to our executive teams as well. Is that anytime you make these type of changes, there will be some issues that come up. But the thought is that the same way we built the changes is the same way we're going to fix it, as it comes through, and so we're going to do it as a team. And so this has been a big initiative that we've been very excited about this year and already have seen some good results. And what we're hoping to do in a number of ways, not only unify our revenue cycle, one, enhance that patient experience so patients are only receiving one statement versus multiple statements anywhere you go across Rush. And then it'll allow us to scale as relates to the solutions that we're investing in, the automation that we're investing in, and who we partner with.
Yeah, that brings me to my next question. For this particular initiative, did you have to work with a specific solution provider or a vendor? If so, how did you go about selecting them? Or if you were working 100% internally, how did you arrive at a good solution architecture?
Yeah, so we did a lot of partnership actually with Epic. Epic is our EHR system. So inherently, we want to get experts who know Epic and have boost resources, things like that. So I think that one comes innately. The other partner that I'll just kind of call out, we did a large engagement with Huron Consulting maybe about a year and a half ago, right, on some normal revenue cycle, just kind of workflow process. And so I think because they were closely related, right? We had just did a project with them. They kind of knew our workflows and processes, and they were instrumental in helping us to really evaluate. Let's call it an example like our workers' comp workflow or our third party liability. We're doing it one way at one organization, another way at the other organization, and they help us to do a comparative analysis of like who's doing it better, what are the results of it, and from that we were able to make some informed decisions based off of a data driven approach, and that's really at the core of. If I think about my history in consulting and all of that, a lot of those decisions you want to make it based off of data, right? What is the data telling you? How do you make an intelligent decision from there?
Yeah, metrics-based decisions generally tend to be helping with prioritization, especially when there are multiple task lists to be prioritized. So totally makes sense. Now, let's talk about implementation. As you went through the implementation of this project, were there any pitfalls or surprises that you and your team did not anticipate? There was a bit of an aha moment while you were implementing the project.
Yeah, I think the nature of me, I'm very optimistic, right? And so sometimes I have this lens of, oh, guys, everything is going to go great, right? And that's just my nature. And I remember late summer, my team, we were kind of doing one of our leadership meetings, and I could just the tension was kind of palpable where people were just kind of feeling a little anxious around training and what were all the decisions that we made, and who's all of that. And so what we did, we actually came together and we called it a war room session, right? Where I let people just we just talked through everything. We talked through everything from start to finish. My core leadership team was in the room, but we called their kind of level down, and we called them in and just kind of did a fire roundup. Okay, what's the issue? What's the workflow? What concerns do we have? I think when we walked out of that session, we had probably over 100 things documented of concerns. And it's through the great partnership of our DNIS team that we partner with internally. We start to use that as a way to not only address those concerns, but we actually built out a whole website around our service area consolidation with FAQs. And a lot of those questions that we have were the basis of that FAQ, because the same questions that we would have, our teams would have, and the broader organization would have. And so I think with any implementation, this is key. Any new project, anything, you're bound to run into an issue or a challenge or something that you just don't expect. What's really key though is to address those issues head on, right? Get it all out and then figure out a plan to really fix it. And one of the things I always share with our team is that we are not victims. We're not bystanders in this whole thing. We have control. And so the main thing is just, as issues come, how do you quickly identify them, but then how do you address them?
Makes sense, Blake. It sounds like the three themes that I heard from your response was cross-functional collaboration, proactively seeking feedback, and making sure that everyone has visibility into what's going on in the project. Some great pillars. Thank you so much for those amazing insights, Blake. One last question for this segment before we go on to a short break. Could you talk a little bit about how did you measure impact for this project? And if you can share at a very high level, without sharing specific numbers, at a very high level, what was the impact? That'd be really helpful for our audience.
Yeah, I think the impact of the project in and of itself was probably based off of where we hitting the milestones and the timelines that we were expecting. I think the true test, Praveen, if I'll be really honest with you, is going to happen now, right? Like, so how are our revenue cycle KPIs impacted? Do we see any improvements in patient satisfaction, those type of outcomes? I will say, not only through this project, with whatever project, there are tons of KPIs that we look at on the revenue cycle side, and we use that to kind of guide our decisions and to work through, where we need to focus our energy. But I think the real work is set to go right now, and I think we'll be able to come back in the next several months and tell you how well did it really go.
Fantastic. Thank you so much again for sharing some wonderful insights about what is arguably one of the toughest initiatives your organization has led. With that, let's take a short break. When we come back, we are going to be listening to Blake's perspective on up and coming technologies like agentic AI. Stay tuned.
The RC Executive Lounge is proudly sponsored by rchq.com. That's ARCEEHQ.com, where agentic AI is transforming how providers manage patient payments and financial aid. Providers using RCHQ are seeing more collections, less manual work, and greater access for patients in need. Visit rchq.com to learn more about the platform and schedule your personalized demo.
Welcome back, everyone. Thank you for staying tuned. We're going to get back to Blake now. Blake, as I mentioned, let's dive into some up-and-coming technologies. Again, anytime you go to any of the events like HFMA, MGM, and all, agentic AI is a buzzword that you hear a lot, right? Can you talk a little bit about what role do you see agentic AI playing in revenue cycle in your organization in the year ahead or even in the next 3 to 5 years?
Yeah, it's an exciting time, Praveen, in healthcare. I can remember the days when we were talking through kind of the journey to automation or how do we start the automation. But I think we really are seeing some tangible results now as it relates to AI and automation. I think we're finally there. And I think really there's so much focus around AI in the revenue cycle space because it's ripe with opportunity, right? There's so many transactional things that are happening in revenue cycle that it makes it a good playing ground for this type of technology. And so what I would call out is if you think about really any major function around the revenue cycle, I can really see in the next several years, there will be an agentic agent to do a lot of that work. And so if you think about pursuing authorization requests, right? And ingesting that back into your system. I can even see some work with financial counseling and helping patients navigate whether they would qualify for Medicaid or financial screening. A lot of our billing and follow-up, you can do that from an agentic perspective. And I think one thing I'll call out from a Rush perspective, and something we're really proud about, is that we were the first Epic client to go live with the AI billing chatbot, right? Which helps our patients as they log into my chart, help them navigate things like, hey, if they want to itemize bill, if they have a question about their bill, even if they want to apply for financial assistance, it helps to navigate that to the patient real time. Even if the patient wants to set up a payment plan, they don't have to talk to anybody at all, but they can do it right there via the chatbot. And so, as this technology comes about, I think like most organizations, we're all faced with how quickly can you ingest it, right? How quickly do you make sure that whatever agentic agent or AI that you're using, you can do it with the minimal level of risk. And that's kind of one of the things we try to think about is, this is something we want to be an early adopter, but we want to minimize risk. And so this has been one of those areas that we've seen some really, really good improvement. We're excited about it. And as more technology comes in this space, obviously we'll continue to evaluate it just like so many others.
Very exciting. And following up on that topic, do you think there are areas where AI or agentic AI specifically can truly shift the game, not just incremental improvements, but more like real 5x, 10x transformation?
Yeah, I think so. I think honestly, Praveen, I don't think there's a whole lot of limit. The thing is, with most of these AI solutions, it's constantly training itself, and I think that's key. It's not only training itself based off of your data, but it's training itself off of any client that they ingest. And so I think when you do that, you'll continue to see more and more scale as relates to the impact of it. It's one of those things we're having to even shift how we think about how we train our staff. How do we, shift work for base level stuff to more things that we would need somebody to be involved in and look at. And so it really not only is a shift in technology, but it really is a cultural shift in how you think about how you have to lead people, how you have to train people, how do you have to prepare them, right, to have a good career path still in revenue cycles. There's still a lot of work to do, and we're getting there, but we're not there yet, obviously.
That makes sense. And outside of AI and agentic AI, are there other technologies that you and your team in general are exploring either to make RCM better or broader healthcare better for Brush?
One thing that's interesting is payer platform, and it's a tool that's embedded within Epic, and I think Epic is probably the first one that really kind of is able to kind of do some of these connections, but you see it happening a little bit more and more. But there's more and more connections with the payer in and of itself, right? Where they have insight to your system, you can kind of get into their. So I think the more that we see that, it should actually, in my utopian world, right? This is me being super optimistic, help relieve some of the administrative burden on both ends, because I can only imagine all the administrative burden that we go through on the hospital side. I think there's the same admin burden that happens on the payer side too, right? And so I think the more that we have technologies that can help lessen, that burden, not used as a ploy to increase denials or increase, delay in payments, things like that. But if we can really use it as a tool to make things more efficient, it will help the overall patient experience, and I think it would help both sides of the fence here.
Makes sense. One last question for the segment. Is there a metric that Blake, you as a leader, obsess over every morning? When you wake up, it's the first thing you look at, and if for some reason the data is messed up, it's like, oh my God, what's happening? Is there such a metric?
Yeah, I would not advise any revenue cycle leader to only hone in on one metric and call their life successful. I would not advise you to do that. But what I will say is cash is still king, right? So we look at our cash metrics pretty much on a daily basis. But what I also say, Praveen, is that some of the metrics that I look at today, I wouldn't even thought to look at years ago, right? So if you think about your core revenue cycle KPIs, AR days, denial management, bad debt, POS collections, all of those CFB numbers, candid bill, those are ones that we look at still every single day to see where things are fluctuating. But there's a whole dashboard now around automation in Epic that I look at, just as regularly. And I think you'll see more of that. Like, what are your AI tools actually doing, and you'll actually see more KPIs that are driven around the results of that you have to pay close attention to as well.
That makes sense. Blake, thank you so much. Cash is king. Very powerful insight. With that, let's take a short break. When we come back, we are going to hear about Blake's leadership philosophy and how he thinks about navigating some really tough leadership challenges in the complex world of RCM. Stay tuned.
Today's episode is sponsored by rchq.com. That's ARCEEHQ.com. If you're looking to reduce friction in patient payments and increase access to financial assistance without overwhelming your revenue cycle team, RCHQ's agentic AI platform might be exactly what you need. Head to rchq.com to learn more.
Welcome back. We are here to listen to Blake's perspective on leadership challenges. Blake, let's start with a topic that you alluded to earlier in one of your responses, which is change management. You mentioned that for the complex initiative, when you brought multiple teams together, there were a lot of challenges in terms of navigating change across all these teams. In general, how do you approach change management? And what do you think is a good way to build momentum when you are making changes at scale?
Yeah, that's a very interesting question, and it really is a fine walk to walk. I was fine line to walk, and so um, one of the things I kind of shared early on in kind of the journey in this new role is, I spent a lot of time with people just trying to understand kind of what do we need to fix, what do we need to do, that type of thing before we did anything. We also kind of formed a vision together from a leadership perspective, but and even the frontline staff had an opportunity to reply to a survey, so they felt a part of it. But I think the biggest thing for Bain is that whole saying of communicate, communicate, communicate. If you are going to lead a change, especially a large scale of a change, you have to be so intentional with your communication. One, informing people to the best of your knowledge, transparently and truthfully, exactly what's going on. We had a situation, I'll give an example. We had our leadership team that I'm trying to start to build out our org structure. And I spent some time. We had decided on, okay, here's what the future org structure would be. And I was communicating to our team, okay, starting in, let's say, June, we're going to start recruiting for these roles. Well, June turned into August, right? And so I had to be very transparent with why we were delayed, what was going on. And one, to continue to tell people, exactly why, right? The why and what we're doing. And I think when you're making big changes, when you lead large teams, there's a lot of assumptions that can happen. There are a lot of questions that are going on that you never really hear about. So it's very, very important to over communicate. And again, communicate truthfully and to the best of knowledge that you have at that moment, right? And if you have new knowledge, kind of come back and say, here's what we're doing differently. And so we were able to do that through monthly town halls. We were able to through surveys, things like that, and we continue to do it. And Praveen, if I be really transparent, it's still a challenge and it will be an ongoing challenge because at every new milestone, you have to kind of recommunicate, okay, what are we doing next? The other thing I'll just quickly share is that when we kind of laid out the roadmap, at the onset, we laid it out really for a full year. So every single month, I'm speaking back to that same plan of where we started, what we were planning to do, where are we in that plan, and what things have to be modified or changed. But the team knows fully, transparently, what we're doing, why we're doing, what we're focused on, and where we're going.
Essentially, communication is key to building trust. And it sounds like communicate, if required, over communicate to build trust. That totally makes sense.
Yeah.
A related question here, right? Based on everything you have seen as a leader, I mean, your leadership journey has been pretty interesting, from patient access to consulting to growing into this role in RCM. You've had a pretty challenging journey to get to such an amazing position. If you were to give one piece of advice for a fellow leader in RCM or a CFO in a hospital system, what would it be?
Yeah, that's a great question. I attended a CEO luncheon last week, and it was a lot of CEOs in Chicago, healthcare CEOs. And one of the things that I walked away with, and they talked about it, it was like a resounding thought, is the focus on partnership. And I think all too long in revenue cycle, you feel like it's an isolated space. You're the only one going through it. But the biggest piece of advice I would give you is to identify your pit crew, right? So if you think about race cars and the cars, the tires get wore out real quick, you need to make sure everything is in check. They have a whole pit crew that helps support them in that race. And I would say the same thing to any revenue cycle leader, any CFO is you got to identify your pit crew. And so that pit crew could be members on your team. That pit crew could be your colleagues at work. Sometimes you need people who are in your organization who can advocate for you. That pit crew could be your leaders, right? You got to find mentors within your org structure that can kind of help and advocate for you as well. And then that pit crew could also be your peers in the industry. One of the things I did, kind of starting into this role is I reached out to a few of our neighboring hospitals, and we now meet every single month, and we talk about the challenges that we all have together. We don't see each other as competitors; we see each other as allies. And they recommend vendors. I recommend vendors. They recommend process. I recommend process. And not only are we doing that from a local perspective, but I found through a lot of these, organizations that I go to. I built that network even nationally, right? I have people I can call all over the country to help me. And so I think everybody needs that. Everybody needs a pit crew. Everybody needs a team that can help in this journey because it's not an easy thing to do.
That's a fantastic insight. One last question to close out the episode. Is there a book, a recent book, podcast, a video, a movie even that inspired your leadership philosophy, especially you getting into this significantly senior role, a much more challenging role? Is there such an incident that significantly inspired your leadership philosophy?
It's interesting. I'm a big Audible guy. I like to listen to Audible books, and through a course of a year, I'll probably listen to 4 or 5 different books. Two that I have recently listened to is The Effective Executive. I'm currently listening to that one now, and again, it kind of what you'll notice if you read a lot of these books is they have some themes that are very consistent, right? So kind of, focus on one thing at a time. That was in the one thing. That was another book that I read and enjoyed. And then the other book that I'm reading is or listening to is the 5 dysfunctions of a team. And that one is really good in terms of as you are building out any team or any group, you'll start to notice these little nuanced things that happen with any team. And how do you navigate around some of that? How do you get people to really focus on a common vision, common goal, and hold each other accountable, build the trust and all that? And I think so many of what we do in leadership is it's not that you need to lead from the top down, but if your leadership team is not where it needs to be and they're not together, you can only imagine what's happening under them and under them and under them. So we try to be very intentional about how we are standing up and aligning our teams.
Blake, this has been an amazing episode. Thank you so much. I know our audience are going to walk away with so many new insights, and they have a lot to take away from today's episode. Thank you so much for joining us today. To our audience, thanks for tuning in to the RC Executive Launch podcast series. If you enjoyed today's conversation, be sure to subscribe on Apple Podcasts, Google Podcasts, Spotify, or wherever you listen. And if you would like to be a guest on a future episode, head to rchq.com and look up the Revenue Cycle podcast series link to learn more. Until next time, I'm Praveen, and this is the podcast where RCM leaders lead the conversation.